So very quickly now, through the rest of the presentation, is that we are faced with some global challenges related to lifestyle and modern lifestyle consequences, which are effectively a ticking time bomb, and do need to be addressed if we are not going to really cripple the resources that we have in national health services. So there's a number of challenges to do with sedentary lifestyle, quick convenience food, comfort eating, inadequate exercise, the couch potato syndrome, which unfortunately I kind of lapse into in the evenings on occasions, and the fact that we live in what's called, I believe, what I call a spectator society, and that is that rather than participating in a lot of things, we observe and watch from the outside, and we take less and less responsibility for what happens in our lives. So these changing lifestyles and consumer empowerment, it's a double-edged sword. I've already seen and demonstrated through Frank Bingley's story how technology is very empowering and enriching to lives, but the more and more technology does for us, the less and less physical mental challenges that we have in our lives, and these contribute negatively to our health. So this is a picture of my mum when she was in Kettering General Hospital with dementia. She eventually passed away a few months after this picture was taken. And so we're living in a society where our life expectancy is increasing, and the number of people in the working population compared to the number of retired people is continuing declining. And this results in a bigger demand for elderly care. So what can we do about it? Well, serious games and gamification and the use of combination of those with technology can help to address these global challenges. And it's a combination of a number of tools that are coming onto the marketplace that help us to monitor and understand our personal health better and give us at least the chance to have more influence over our personal health. But we need to transition from a society which is based on a focus of health for cure, medicine for cure, to tools and techniques and technologies designed to prevent ill health in the first place. And I use this analogy of the body being compared to a car, and your body is the car that helps you navigate life's journey. So our body is our journey vehicle that takes us from the cradle to a grave, and we go through a number of different stages in our life to our final destination. And we don't really know what the condition of our body is or how best to maintain it. But the same was true of cars before data technology. We had to rely on garages and knowledge professionals to keep our vehicles on the road. I'm just going to pause at this point to check to see whether I'm still recording on my Ricoh Theta V. The Theta V has a recording time of, well, a maximum of 25 minutes, and so I've seen that it had stopped recording, so I've started it recording again, and it will have up to another 25 minutes of recording time. So I'll have to find a way of editing the Theta V recording when I publish that to the web sometime later this week. So going back to cars before data technology, we had to rely on knowledge professionals like garage mechanics to be able to maintain our vehicle. And in the same way, we rely on knowledge professionals like doctors and nurses and consultants for understanding the way that our body works and helping us to get the best life experience with our body. But in the 1950s, and when I was growing up, our cars had frequent breakdowns and had to be repaired quite frequently. But as the technology of cars has developed, we have not only cars which diagnose and maintain themselves to a certain extent, but we also have a variety of tools and graphics that help to show us where the car is and how to navigate out to our journey. They show us the condition of the vehicle and help us to monitor that condition, and they give us advice and guidance if we happen to go off track. So lifestyle technologies, in my opinion, like wearable devices, will be the tools which will transform health management in the same way that the technology that's within cars has helped to restore or change or totally transform the ecosystem of cars and the stakeholders involved in maintaining, selling and developing those cars. I think the same will be true of the health ecosystem, and more we will see devices being used to help us to monitor our condition and help us to take better control over our lifestyle and our body condition. So I developed a term called the GamNav, and the GamNav really is equivalent to the sat-nav. It shows us where we are in our life's journey on health, and it gives an opportunity to identify where we'd like to be and provides us with tools and advice and guidance to help us get to where we want to be with the best possible journey, whether that's in the shortest space of time, which in life's journey hopefully is not a shorter lifespan, but the quality of the journey, taking us through places that are going to be enjoyable and having experiences in our lives which we hope to enjoy. It's getting the best from life using this combination of technology and human skills. But the challenge is, how do we change personal behaviours? How do we get out of this couch potato syndrome? How do we tackle problems like teenage obesity when technology is having this combined positive and negative effect? Positive in that it gives us all this information, but negative in the sense that it removes some of the challenges and influences of our daily life which are for our own good. So if we look at the kind of stakeholders who can influence our future health and our personal health management, we've got the medical professionals, we've got the technologists like Apple, we've got fitness coaches, we've got politicians who are developing policies to try and shape public health, we've got researchers, we've got the fast food outlets who could influence our health by making sure that they've got the right nutritional value, and we've got the media, but we also have ourselves, the finger pointing at us. We have a lot more control potentially over our personal health than any previous generation if we want to take that opportunity. So one of the approaches, and I'm not saying that it works for everybody, every human being is individual, they've got their own lifestyle, they've got their own challenges, they've got their own constraints, but this combination of gamification, identifying the factors that are going to most influence people's behaviour, combining those with enabling technologies like wearables and personal health management tools, these provide the tools that give us measurement and feedback, which are essential elements of gamification. And the measurement can be snapshot data, which you will get if you go onto a weighing scale, or if you're using one of the more modern Wi-Fi devices. These are also capable of measuring your body mass index and also your fat and your water content. So they provide a much richer set of information, and these bits of snapshot data can tell you where you are in life's journey and gives you an insight with professional advice on how to go further with your journey and enjoy your life's journey a lot more. And then you have increasingly real-time measurement devices. So although most of the devices at the moment, they accumulate data and they supply it to a mobile phone, increasingly they will be monitoring data in real time so that, for example, if you're monitoring blood pressure, or you're monitoring some of the COPD characteristics like oxygen saturation, you're monitoring your heart rate in real time, you can get early warning of serious problems. And if this data is shared with a trusted health professional, it could make the difference between life and death if you're alerted to a situation and you're given the right kind of advice to be able to tackle it. The mobile applications are also very, very important, and I've seen quite a number of changes in the way the mobile applications have developed, from simply being dashboards into tools which provide not only statistical analysis but also some hints and tips. And this is an area where I think the manufacturers of wearables are treading very carefully, and they have to tread very carefully, because if they give advice which is wrong for an individual, and that individual has a stroke and dies because of taking advice on exercise inappropriately, they face the danger of litigation. And so companies like Jawbone, they achieve a little bit of a balance by not being prescriptive with the advice, but giving links to professional medical websites which say, for example, that if your sleep patterns are becoming a little bit disturbed, they will link you to a medical website which tells you about the importance of hydration, some of the factors which can help with sleep. So they are kind of avoiding the issue of providing direct medical advice by linking to hints and tips. So for the ageing society, one in which I live in, I'm 68 years old now, but I feel as if I'm 48. I still have a zest for life, I still have a lot of energy, and I still walk at least 5 miles every morning when I can. But I see strategic partnerships with international developers of game-based solutions will help to stimulate cognitive and physical exercise. So products like Rehability, developed by Milan-based Imaginary, are not only tools to help with rehabilitation of stroke patients, they are very symbolic because they create this relationship between the patient and the medical practitioner by collecting data about performance, about well-being, making it available not only to medical practitioners but where appropriate to families and carers, and to create an ecosystem where people are not only healthier but they also are able to contribute positively to the social and economic development of society even when they go past retiring age. So the lifestyle technology roadmap, from my perspective, and this is where I look at where things are going, is that I see that wearable consumer devices like the ones that I'm wearing at the moment, and like the Apple iWatch, Fitbit, etc., they are providing increasingly advanced health metrics. They're going beyond simple consumer entertainment devices, for want of a better word, into increasingly devices which will be accredited and authorized by medical societies like the FDA in the USA, for example. I think at some point in time, although it's a very contentious subject, that healthcare costs will be linked to lifestyle behaviours. And personally, I think that everyone has a right to best medical treatment that is available at the time, but in a scenario when it's not affordable, I think there needs to be incentives for people to adopt healthier lifestyles, and importantly to share their data for the benefit of society. It's a little bit like some of the motor insurance companies now are offering incentives to people who have tracker devices in their cars that monitor how well they're driving, and if they can demonstrate that they're driving well, they get some reductions on their premiums. So I can see also a revolution in the healthcare ecosystem, which means from my perspective that healthcare is something that will not only be purely the domain of the medical professional or people who've trained in medicine for years and years. There will be entrants into the healthcare sector whose background is totally different. Whose background is about behavioural science, it's about life coaching, it's about developing relationships like fitness coaches, etc. So a lot of people new entrants will play an important part in public health in the future. I can see, and we already do see it, the use of wearable lifestyle devices for identity application. So I can see they're being used as a way of providing a personal ID, because they are able to develop a unique relationship with the wearer of device, so that when you go to, for example, a till in a supermarket, you can use your wearable to identify you and link that to your bank account. I think also that it will provide very useful applications in the future for people like dementia sufferers, where a wearable device has a GPS tracker, and if someone gets lost or if they feel in danger, they can touch the wearable or tap in a code or some kind of intervention which lets people know that they are in trouble and can provide them with instantaneously help. And I also see a growth in embedded devices that are not only monitor our health and our physical condition, but also begin to control it. And we've already see this with some of the devices which are being used for insulin monitoring and providing pumps which will inject insulin when the diabetes sufferer needs it. So increasingly, the management of our health will be a combination of our human capabilities, our human understanding, our human motivation, and also interventions that use artificial intelligence and embedded devices in our bodies. And when we get to this stage, I think the scenario that Ray Kurzweil presented in his singularity proposition, and that is eventually that human beings will have the opportunity to be immortal. I think that is likely to come about, and it's conceivable that it will come about within my lifetime. And then society will face a whole raft of different kinds of problems. We already have enough problems in our society to do with personal health management, but it adds a totally new dimension to it and a complete rethink on how we organise ourselves as human beings, because if we don't do the right kind of job, we face some serious consequences. So that is the end of my presentation. It's taken about 40 minutes. I've recorded it on my PowerPoint, so hopefully I will be publishing all of these different media later this week. For those of you who've been watching live, I appreciate you taking the time to do that, and thank you. Watch out for the recording.